cancer surgeon by training, but I'm focused on women cancers and in particular breast health. So my forte is in breast oncoplasty, which basically all of you are aware that the traditional treatment for breast cancer consists of removal of the entire breast, while I offer a unique situation where I apply plastic surgical techniques so that I remove just the tumor and the rest of the breast is retained and the breast almost appears as normal as humanly possible. So that's my particular interest. All of you are aware that October is a breast cancer awareness month, and that's the reason why we are all here. And I thank everybody who has taken time to be here to go through this process of creating awareness about breast cancer. I represent Ankura Hospitals in Gachibowli, where we have created comprehensive one-stop breast clinics. In this facility, we offer complete breast care, and it is not confined to cancer as most believe. In fact, in my 20 years of experience, a significant proportion of women, almost 90% of women, actually come to me with non-cancer related breast issues, which dominate the disability that is caused by breast problems. So even though October is all about breast cancer, I'm going to spend a significant amount of time trying to create some overview of non-cancer related breast issues that women face and how to address them and how to take care of them, while I progress on to help you understand what exactly breast cancer is and how all of you can protect yourself. I'm assuming most of you are in the 30s, 40s age group, and this is absolutely the right time to be aware of breast issues and learn how to take care of yourself. In fact, I need to point out to you that today the number one cancer in women in India is breast cancer. So, and if we compare the breast cancer that we see in India compared to the West, Indian women develop breast cancer at a much younger age. I've seen patients as young as 14 and 15 years developing breast cancer. So it is very important that the Indian women should be aware of how to protect themselves. So before I actually convey to you about breast cancer and breast diseases, I just want to give you an overview of how the physiological problems that an average woman faces in her entire lifetime. I assume that all of you will accept with me that every lady will pass through the phase of menarche, the onset of menstruation, goes through adolescence, and it peaks out around pregnancy and fades at menopause. And I assume most of you will accept that each of these phases has been a challenge for you, both physically, mentally, and psychologically. In fact, it is not an overstatement if I say that adolescence affects the mind, pregnancy affects the body, but menopause affects the spirit of the lady. The one common thing across all of these phases that every woman passes in her lifetime is the hormones. Each of these phases is associated with some sort of an imbalance or a change in the harmony of hormones, the female hormones in the female body, which causes these issues. And many a time during these phases, these women actually reach out to medical help. One thing we should all realize that none of these health issues should be treated as a disease. In fact, they're normal physiological changes. And as a doctor, I believe that what the woman needs in these phases is just a helping hand, a guidance of how to handle the situation. It is not a pathology, it is not a disease. It is only that I need to help the woman adjust to these issues in these phases of life. With that background in our mind, let's move on to the next slide. So just to repeat myself and emphasize, hormones are not just about fertility. This is a common information general public have. That is what I've noticed. Many believe that hormones are very important for fertility and Hormones do not have any other role. In fact, the female hormones play such a significant portion in their entire lifetime. Every aspect of female life is related to hormones. The female hormones, as we all know, are estrogens and progesterones. So these hormones are produced from the ovary, and through the bloodstream they spread across the body. Two important organs get influenced by these hormones every month. Obviously, it is the uterus. All of you are aware, because of your monthly menstrual cycle. Whatever that you experience during each menstrual cycle is exclusively because of these hormones. But many might not be aware that not only these hormones act on the uterus, the same hormones acts on the breast. And whatever changes, whatever discomforts that you experience during this menstrual cycle is again because of the hormones. In fact, I would like to say that if any of you want to interrupt me, want to ask questions, or you want me to speed up or slow down, please feel free to do that. Am I clear? Hello? Right. Okay, fine. So, coming back to the female menstrual cycle, every lady passes through this phase every month, and basically what happens is, with the start of the cycle, there is increase in estrogen, and it peaks around the mid of the cycle, from where the progesterones also pick up, and the peak is reached towards end of the cycle, when progesterones and estrogens fall. It is these hormone variations that cause all the good and bad things about menstruation. So whenever a lady passes through this menstrual cycle, the hormones, as I told you before, affect not only the uterus but also affect the breast. The breast undergoes an expansion of the milk glands that are present in the breast. They swell. There is accumulation of water in the breast. So most of the symptoms that women experience during this phase is because of the water logging that happens in the breasts. The breasts become large, the breasts become heavy, and in fact, some women complain that the disability, that the pain that they face is significant enough that they have to actually take a break from their job or take rest. Breasts become quite lumpy and dense during this period. Some women also complain that they are painful and tender. So the entire exercise that is happening each cycle in the woman's menstrual cycle is basically the body is preparing the breast as well as the uterus for pregnancy. This is the way the female human body has been designed. So if pregnancy does not happen by the end of the cycle, then the breasts return to normal. So this happens every month. Over a period of time, some of these changes become actually permanent. So whatever the changes that you experience during the menstrual cycle may also be mimicked by other medical conditions. For example, pregnancy, that is something good. But the same changes are also seen because of something more serious like cancer. So our today's entire exercise is about trying to understand what are these simple, non-cancer related issues that women experience during pregnancy, how to deal with them, and next is how do we differentiate these problems from the more serious issues like cancer. So the whole topic of today's discussion is how do we protect ourselves from cancer? What steps do we need to take in order to help ourselves and protect us and our family members? So if you are experiencing breast pain, if you are experiencing breast heaviness, and these two symptoms are cyclical, that means you experience these in relation to your menstrual cycle, then you can be rest assured, because 99.99% of these symptoms are completely normal, physiological. So you are experiencing those because you are passing those through the phase of menstruation, and menstruation is something completely normal. It is as normal as we have food today and tomorrow morning again we feel hungry. There is nothing pathological, there is nothing abnormal about it. So just the way we accept that being hungry after a few hours is completely normal for a human being, we also need to accept that the discomfort that you experience, all women experience during the menstrual cycle, is completely normal to human body. So your agenda should be to how to reduce this discomfort. And the simple technique is, if it is causing you significant discomfort, you can just take a Dolo tablet, take some rest if it is causing you too much disability, and drink plenty of fluids. It's as simple as that. So the catch here is, all the pain that you're experiencing is cyclical, related to your menstrual cycles, then you can relax. So I just told you that the changes that happen in the breast every month, after a period of time, become permanent. So these permanent changes manifest in the form of a lump, which we call fibroadenoma, and some of these lumps or swellings are also called cysts. But unfortunately, the serious problem that can occur in the breast is cancer, and that cancer also feels and looks in the initial stage just like these non-cancer swellings, fibroadenoma or cyst. So now today we are going to learn how do we differentiate that? How do we take care of ourselves? The word breast is associated with sex, and the word cancer is associated with death. So the phrase breast cancer has become a taboo subject. Nobody wants to discuss this in open, and today I'm going to open it up and let's talk about it in an open, simplified fashion that we all can understand what exactly is happening. So breast cancer can have several symptoms. As you can see, there are almost 12 common symptoms that women experience when they have breast cancer. But in my practice, 99% of patients who have breast cancer present to me with the complaint that they have recently noticed a swelling in their breast. So for you to understand how a swelling in your breast feels like is to imagine yourself trying to feel the seed in this lemon through the skin of the lemon. The feel and the texture is almost going to be the same. I am going into such detail is only to make you realize and help you identify if you have an issue in the breast. And another important point that I want to drive repeatedly is 99% of breast cancer lumps are painless. I repeat, they are painless lumps. And that is the most unfortunate thing, because most of the women who come to me present quite late. They wait at least 3 to 4 months and sometimes even a year before they actually reach out to me. They believe because the lump is painless, they assume that it is nothing serious. They believe if it was painful, they would have come earlier. But unfortunately, what every one of us have to realize is these breast lumps are completely painless. In fact, if there is a pain in the lump, I'd be more happy, because most of the times a painful lump is because of infection or related to the menstrual cycles. A painless lump is something we should be very cautious of. Coming to the risk factors, who are the people who potentially can develop breast cancer? To make it very simple, every lady is at risk of developing breast cancer. The risk steadily increases as the lady ages. The risk significantly increases once the lady crosses 45 to 49 years. India sees around 1 lakh new breast cancer patients each year, and an almost equal number of patients die of breast cancer. If a person is a female gender, their risk of developing breast cancer is 100 times more than a male. If an individual has a family history of breast cancer, like a first degree relative, that is what is important, a mother, aunts, siblings, or grandmother. It is these relationships. If these individuals, any of these individuals in our families have breast cancer, our chance of developing breast cancer almost doubles. Another important thing I want to highlight is most believe my family does not have breast cancer. None of my family members have breast cancer, so I'm protected. which is absolutely wrong. Almost 85% of breast cancers that I see in my practice, they are the first time they are having, any family member is having breast cancer. So what I want to drive is the presence of breast cancer in the family is not necessary to make you feel that you are at risk. Almost anybody in the general population without any history, without any so-called bad habits can still have breast cancer. Which basically means every female is at risk of breast cancer and needs to take steps to protect herself. Some of the common things we find among women who develop breast cancer is they have heavy, dense breasts. When I say dense breasts, basically I mean, it's a medical term, basically I mean there's a lot of glandular tissue and less of fat. Women who are obese, whose BMI is little on the higher side, have at increased risk. Women who consume significant portions of alcohol are also at risk. To put it in another way, just because somebody is not fat, somebody doesn't consume alcohol, does not mean they are not at risk. I'm only saying people who have these have a higher chance of having breast cancer. But the very fact that an individual, a human being is female, is itself is a risk for developing cancer. The longer an individual survives, higher is the risk of cancer. Which basically means as we live longer, we are exposed to more pollution, we are exposed to more dietary influences, we are exposed to more to our lifestyle, and all of these factors play in to create a risk, an inherent risk in ourselves to develop breast cancer. So the presence of cancer in the family or use of alcohol, cigarette smoking, all of these are one of the many risk factors that might cause breast cancer and not necessarily the only risk factors. Why I'm stressing this point so much is I keep hearing in my practice patients coming to me and telling me that they live a very healthy lifestyle, they do not smoke, they do not have alcohol, but still they got cancer. Why did I get cancer, doctor? It's basically because of so many factors. We call this multifactorial. The significant problem is when we do not have a single reason, it becomes even more difficult for us to protect ourselves. And we need to be extra cautious in taking those steps to protect ourselves. And that is why we conduct these breast cancer awareness meets almost every year in October. So as I said, most of the women present to me with lump in the breast. But when the disease is in early stage, these are some of the other symptoms that I commonly see. Nipple discharge. The discharge could be blood stained, the discharge could be watery, but that is one sign. Sometimes there is a subtle dimpling of the skin on the breast, as if there is a small pull inside. Sometimes the skin appears little thickened, or there could be some sort of redness on the breast skin. So these are the signs or symptoms we see in early phase. If the disease has progressed, then the skin of the breast almost looks like an orange peel with all those small dots, which basically means the disease has come and involved the overlying skin of the breast. We don't want to catch the disease at this stage. We want to catch when it is in these stages, when the treatment is very effective. If the patient moves on to this stage, the treatment becomes more complex. We need to go through more procedures. So obviously we want to simplify the whole process, so we want to find the disease in an early stage. Sometimes when the disease is advanced, the nipple gets completely inverted. It is as if it is being pulled inside. And sometimes we see a bump on the breast also, as if there is a projection coming outside the breast. So what do we need to do? We need to get aware of what is the possibility of one getting cancer and what are the symptoms if somebody has cancer and how do we identify. So we will be able to identify changes in our body when we are aware of our body. So this what we call is a breast self-examination. Basically, we ask every lady once she crosses 25 years to examine her breast on a particular day after her periods. The reason why after periods, because once the periods are done, the hormone levels come down, the breast swelling comes down, breasts are less tender, and then when you can actually comfortably palpate, feel the breasts. And we want you to do on the same day every month so that there is no variations that are happening because of the hormones. And you keep on doing the same thing again and again every month, then you become so clear, so obvious and aware of the smallest changes that can happen in your breast. Basically, what happens is once you're very aware of what is normal for you, then it becomes easy for you to identify what is abnormal in you. And this identification happens at a very early stage because you know, this small lump I didn't feel last month or in the last few months. This is something appears to be something new. And once you realize that there is something new, obviously you will go to the nearest doctor. As I told you before, all these changes, the cancerous changes that might happen, are actually painless. So it is more important that you should be aware. And we want to capture the disease when it is at a very early stage. So this is what we encourage all young women, all the women in the general population who do not have symptoms. It is these women who have to do breast self-examination. The second thing we encourage women to do is to go to their doctor, a breast specialist, not anybody. You need to go to somebody who is focused on breast care every year and get an annual mammogram. This needs to start from somewhere around 35 to 39 years and needs to continue till at least 60 years. Why do we need to do every year? Basically, we need to do every year because the smallest change that can happen, when I have repeated pictures, I will be able to compare what was the appearance last year and what is the appearance this year. And I will be able to identify increase in size or changes in shape or density. Just the way you need to examine the breast by yourself every month for you to know what is normal and abnormal. As a doctor, I need to see multiple pictures of your breast to know what is normal or abnormal for you. And there is a reason why we ask our women to get annual mammogram and keep these mammo images with yourself and bring it to the next year consultation so that we have an opportunity to compare with the previous year's images. So what is mammogram? It is nothing but an X-ray of your breast. Basically, we pass X-rays through your breast and we will be able to see through your breast as if like what is done in the airports where they scan our luggage. Similarly, we are scanning through your breast and trying to see what is happening inside. And when I compare these images with the last year images, if something new, a new calcification, a new radio density or a new lump has appeared, I will be able to identify that, okay, this is something that is new and it is increasing. Then I need to do some investigations to identify whether this abnormality is related to physiology or is it related to cancer. So mammogram needs to be done every year. So at Ankura, what is it that we are offering? We have a highly focused breast care unit. We have a team of people, which includes me as a breast specialist. I have with me a breast radiologist who is focused on breast ultrasound and mammogram. And the radiologist we have at Ankura is a female for your comfort. And apart from this, we have a breast pathologist who is again focused on breast diseases. The presence of specialized focused people in a team improves the quality of service that we can offer. So we offer breast specialist consultations, breast ultrasound, breast mammograms, and cancer screening at Ankura in Gachibowli. Further, we offer surgical services, almost car-free services for breast lumps. We offer plastic surgical techniques to handle the armpit fat. We have a complete range of investigations to help detect any abnormality that is detected either by ultrasound or mammogram. We have access to MRI, CT scan, and other diagnostic imaging. And of course, we have services offering for cancer screening, counseling women who have a family history of cancer. We guide you, we handhold you in identifying or getting the genetic tests that need to be done if you have any family members with this breast cancer, ovarian cancer, or uterine cancer. Apart from that, obviously, we offer a complete range of cancer treatments that includes cancer surgery. I've already told you that my personal expertise is offering non-mastectomy without removing the entire breast. How do we treat cancer and retain the breast? And that is called oncoplasty, and that is my personal strength. Apart from this, we have access to chemotherapy and radiation treatment facilities. We also offer aesthetic breast surgeries like breast lift, breast augmentation, nipple corrections, breast contouring, and lipofilling. Coming back to the main topic, October, as you're all aware, is a breast cancer awareness month, and the importance of this month is to create awareness among all women about their breast and encourage them to do breast self-examination and guide them to help themselves and protect themselves. Thank you very much for your patient hearing, and I'm ready to answer if you have any doubts, any questions or suggestions.